Hello. Hemoglobin A1C, that is glycated hemoglobin A concentration. It is the measurement of average blood glucose concentration of the diabetic patient over the preceding 3 to 4 months. And the hemoglobin A1C concentration or hemoglobin A1C depends on two factors: red blood cell lifespan and average blood glucose concentration. If the blood glucose concentration of the patient over the last 3 to 4 months was high, hemoglobin A1C will be high. And if the blood glucose concentration is enough control, hemoglobin A1C will be controlled or within normal range. It is very clear to us. But the problem is RBC lifespan, which I put here number 1 factor. As the hemoglobin is the component of RBC, so hemoglobin is related or associated with the lifespan of RBC. If RBC lifespan vary, the hemoglobin A1C will vary. Okay. If RBC lifespan is reduced, hemoglobin A1C level will be reduced or lower than the expected. And the RBC lifespan is increased due to any cause, the hemoglobin A1C will be found higher than expected. Okay. Now, number 1, if the RBC lifespan is reduced due to sickle cell anemia, glucose 6-phosphate dehydrogenase deficiency, or hereditary spherocytosis, like these, due to any cause, if RBC lifespan is reduced, the hemoglobin A1C level will be found lower than the actual, than expected. Okay, so these are the condition. I put here only 3: sickle cell anemia, glucose 6-phosphate dehydrogenase deficiency, hereditary spherocytosis. As we know, all these three causes are actually causes of hemolytic anemia. In this condition, RBC lifespan is decreased. So hemoglobin A1C will be found decreased or lower than the expected level of hemoglobin A1C. Okay. Number 2, if due to any cause RBC lifespan is increased, then the hemoglobin A1 concentration will be found more than the expected. The cause I put here again 3 only. Number 1, vitamin B12 or folic acid deficiency, that is megaloblastic anemia due to any cause again. Number 2, iron deficiency anemia and splenectomy. In these conditions, RBC lifespan is more than the normal, that is 120 days. And as the RBC survive more than the usual time, the hemoglobin A1C level found more or higher than the expected, than the actual level. Okay. So again, hemoglobin A1C depends on 2 factors, mind it: RBC lifespan and blood glucose concentration over the last 3 to 4 months. Finally, here is a small math. The question is, can we measure the average blood glucose concentration from the hemoglobin A1C of the patient? Yes, we can. We can measure the average blood glucose concentration from the measured level of hemoglobin A1C. What is the equation? Yes, here is the equation. Average plasma glucose level equal to 2 into hemoglobin A1C minus 4.5. Say the measured level of hemoglobin A1C is 7 of the patient. So average plasma glucose will be 2 into 7 equal to 14 minus 4.5 equal to 9.5 millimole per liter. This is the 9.5 millimole per liter plasma glucose level of the patient over the last 3 to 4 months, while the hemoglobin A1C found 7. Okay. Thank you. Thank you very much.